topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Atlanta. Welcome to another Ask the Experts, where we bring you the top experts in the fields of health, legal, financial, and home improvement. We're with you every Wednesday at 10 o'clock Eastern Time. Must say that because we actually get a lot of emails from across the country. Today, as of last week also, today's show is one of my favorite shows because we discuss weight loss, we discuss hormone replacement, we discuss ED, we discuss stress, and there's no one better to do this than Dr. Eldred Taylor of Taylor Medical Group. Good morning, Dr. Taylor.
Yeah, hello, Steve. How are you doing? Good to see you.
We're doing good. Dr. Taylor and I will be doing a show in Dallas, Texas this afternoon. Dr. Taylor, I am just shocked how many emails we are getting now from TV of people saying they just found our show for the first time and they've become a listener. So because we've got so many new listeners and viewers now, tell everybody about yourself and your practice.
Okay, my name is Dr. Taylor. I'm originally from Nashville, Tennessee. I came to Atlanta to attend Emory University Medical School and did a residency in obstetrics and gynecology. And I practiced OBGYN for about 10 years, like I was taught in medical school. And I got interested in bioidentical hormones, or natural hormones, bioidentical hormones, primarily because my wife, who's also a physician, she was having issues with hormones. And I was doing some of the stuff that I was taught in medical school, giving birth control pills and all those things, and it wasn't helping her. So I had a patient come in, ask me about natural hormones, and I thought that she was off her rocker because, you know, I hadn't learned about it in medical school. And so she gave me a tape explaining it. It was an hour long, and that tape, I wish I knew that patient's name. I should send her a thank you card.
Yeah.
Changed the course of my career. So by understanding how to help the body function better, by giving the body what it naturally requires in order to function, and not drugs that are not conducive to what the body needs or wants, it caused me to start practicing what I call functional medicine. How do you help people function as well as possible for as long as possible? And so in our practice, we do bioidentical hormone replacement. We do a lot of IV therapy. We do a lot of preventive medicine type things, digital pulse analysis, some things that we can talk about in other shows. But so that's the kind of practice that I have now. I'm not anti-drugs. I'm not anti-medication, but a lot of times those are for acute situations, an antibiotic for a serious infection, or, if you have a heart attack, you don't want to come to me, you want to go to the emergency room. But there's a lot of chronic illnesses that conventional medicine is just not good at correcting. And so in functional medicine, we look at things a little bit differently. Instead of waiting till you have a disease, we try to help you to not get that disease and to function better your entire life.
I love the way you explain that. And it's so amazing that you gave up basically one of your specialties in medicine to do anti-aging hormone replacement. And we're going to talk about that today.
Mhm.
The first thing I want people to know, because we've been getting mail from outside the Atlanta area, in Georgia, that people are watching the show, but also in some of the surrounding states. Dr. Taylor can do telemedicine. Is that right, Dr. Taylor?
Yeah, since COVID, the telemedicine laws have really relaxed, because people couldn't actually go to the doctor because we were on lockdown. And so, yeah, a lot of the things I do, of course, I couldn't give you an IV over the phone,
Right.
but bioidentical hormone replacement, because we don't need to draw blood, we'll get into that if you haven't listened to other shows, is that we measure hormones through saliva. So I can send you a kit. You collect your saliva over the course of a day. You turn it in, we get the numbers back, and we can prescribe what you might need just based off of those test results. So yeah, we can do telemedicine. We have patients in several states that we can connect with through the beauty of Zoom and telemedicine.
If you're watching us on TV right now, you can actually see on the monitor uh, Dr. Taylor's website. You can go to his website. You can make appointments through his website. If you're listening on radio now, you can go to www.taylormedicalgroup.net. Make sure you do the .net. We actually
Yeah,
had someone contact us that said it's not going through, but they were putting in .com, of course.
right.
So I want you to know this, because you're going to find today's show so interesting, and you're going to hear things today that you probably haven't heard before. And you're going to find out there are other avenues, especially with weight loss, if you're having problem there, stress. And that's why I love doing this show with Dr. Taylor so much. I have learned so much. My fiance has really, I mean, talk about an endorsement. My fiance
Mm.
is already meeting with Dr. Taylor through the internet, and we found there's so many things, hormones that she was lacking, that explained the problems she was having. But let's get started with today's show, Dr. Taylor. What you brought up functional medicine. What is functional medicine?
Yeah, well, the way I like to describe it is that in medical school, we were taught to be experts in identifying and treating diseases. So if you have a disease, conventional medicine is great. But you have to understand there's certain criteria for you to be classified as a disease. Uh, so if you're perfectly healthy, you're right here. I know we're backwards. I'm trying to go left to right. But anyway, if you're perfectly healthy, you go here. You're here. If you have a disease, you're here. But there is a lot of time that passes between here and here. Okay. So when the doctor tells you come back next year, come back next year, come back next year, come back next year, oh, wow. Now you have diabetes. Oh, wow. Now you have lupus. You have whatever. You didn't get that the night before you went to the doctor. That was something that was developing over the course of time, but you hadn't reached the criteria to be a disease, whether it's a lab result or a biopsy or whatever. So functional medicine looks at how well are you functioning? Are you functioning here? Are your kidneys or your gut, are they functioning here? Well, we don't want to wait till you get to a disease. We want to reverse that process early. And a lot of times patients will come in with very vague symptoms. I'm fatigued. I have trouble digesting. I'm bloating. I'm constipated, or whatever. That they're not a disease, but they can be signs that a disease is lurking. So when you're not functioning well, functional medicine looks at how well is the gut functioning. Is it functioning at an optimal level? How well is the brain functioning? How well is your nervous system functioning? How well is your hormone system functioning? Not waiting till you have the disease to intervene. So that's the difference between conventional medicine and functional medicine. And when you intervene before you get a disease, then the intervention is usually a lot less abrupt. It's a lot less complicated. It doesn't have as many side effects. if you can intervene early than late.
What is now? You went to medical school. You went to one of the finest medical schools in the United States. So, what
Mhm.
is the difference from what you learned in medical school, and what you have learned now?
Well, let's just let me take one example. Let's talk about thyroid disease. Okay, hypothyroid, low thyroid functioning. I was taught you wait until the TSH, and if anybody's gotten a thyroid, TSH, thyroid stimulating hormone, wait until the TSH is above 5, and then you treat them for hypothyroidism. All right. In functional medicine, when it's above 2, we say that the thyroid is not functioning well. We need to try and treat the thyroid. And sometimes it doesn't mean that it's thyroid medication. Sometimes there's two supplements, zinc and selenium, that can help the thyroid function better if you give it that, and also iodine. So maybe they're low in iodine, zinc, and selenium. And now, when that TSH is 2, you can do something instead of waiting until it's 5. So that's an example. So that's the difference in what I was taught. Let's say in OBGYN, I was taught you give patients hormones and you give it to them. Let's say a postmenopausal, you give it to them, and then you don't test it, you don't do anything. But if their mammogram is positive, then you stop the hormones. So, that's crazy. You give somebody hormones for 10 years, they get a mammogram, then you say stop. Well, that's too late. Now they've got something growing in their breast that if you had to monitor their hormones properly over those 5, 6, 7, 8 years, maybe you could have stopped it earlier. You could have changed what you were doing earlier. So that's the difference between what I learned in medical school is wait, 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 wait. Okay, now they have a disease. Now we know what to do. Functional medicine is don't wait. When you see early signs of something, then do something at that point to reverse it instead of waiting until you reach this milestone of a disease.
And let's remind everybody, you are not against conventional medicine.
No, no, not at all. Not at all. But most of the patients who come to me, they've been through conventional medicine, and conventional medicine says that there's nothing wrong. What they're really saying is that you have not reached the criteria of a disease. That's what they're saying. They're not telling you that you're perfectly healthy and that you're doing fine. So I like it when the patient has gone through conventional medicine, so I know I'm not missing some serious disease. So then they come to me and I'm saying, okay, what is the problem? Okay, I'm not sleeping, I'm having hot flashes, uh, and somebody told me hormones were dangerous. Well, hormones that aren't monitored properly are dangerous. Hormones that are properly monitored are not dangerous. So it's all about how you monitor the patient, how you diagnose their function or what you think their level of function is, how you correct it, how you prove that you're correcting it. So all of that is a part of what we do.
Dr. Taylor, why do you think that more doctors don't practice this type of medicine?
It's a couple of reasons. One, I mean, you're a creature of habit, and if you've been doing something for so long,
Right.
people don't like change. They don't like change. Other thing is that most of your education after medical school, if you don't look for other sources of education, most of your education comes from the drug representative that visits your office, and the drug rep he's not a health advocate. He's a drug that he is, drug company he's working for.
Yes.
So he's going to tell you how great his drug is and how you can use it on this, that, and the other. So that's where a lot of the education comes from. The other part is, what does insurance pay for? So insurance pays for when you have a disease and you have this treatment. Okay. It does not necessarily pay for a lot of the functional medicine stuff that we do. It pays for some of it, but not a lot of it. And so what the insurance company pays for is a driving force. What their education is, and how interested are they in doing something different. I mean, it was a leap of faith to changed the course of my career, but I felt like it was something I had to do. My mother, who passed away 10 years ago now, and I'm from the South, so we have all these little sayings. He said, if you don't know any better, I don't expect you to do better. But once you know better, I expect you to do better. So that rings in my head all the time. So when I know better, I have to do better. So I think a lot of doctors just don't know. They just don't know. They haven't been exposed. If a patient comes to me and asks me that question, I'd say if they were exposed to the information that I've been exposed to, it'd be hard for them not to do this. But if you don't look for the information, it's not going to necessarily walk into your office and, get put on your desk.
I got to tell you, it used to be a long time ago, boy, doctors like yourself would never recommend to anybody anything that had to do with holistic supplements. And now you see more and more doctors that refer their patients to holistic and supplemental medicine.
Yeah. Well, it's kind of with the internet and the ability to get information, the patient to be able to get information, to hear shows like this and other shows that are on YouTube or whatever. It's becoming more popular. The vegans, all these are very health conscious people. My daughter, who's 26, she works in my office. She's very health conscious. She gets on me about, doing something that may not be the best. She saw me with some toothpaste that had fluoride in it. Dad, how could you be using this toothpaste? I'm like, oh gosh, I didn't have any. So I think that this generation coming up is very, very health conscious. And so doctors are forced to, to be able to allow these patients or tell these patients where they can go and actually get the help that they're searching for. So, things change slowly. In medicine, things change at a snail's pace. That's for sure. So, I've been beating this drum for over 20 years. So, so it's not like it's been a overnight change, and still we're still in a minority state for sure. Doctors who kind of practice like I do.
Well, I'm going to ask you a question that we've just touched on maybe a few times, but please take this question from, I really trust you. I have learned so much from you, Dr. Taylor. Mm-hmm. What were you telling your patients when COVID arrived?
Okay, when COVID arrived, I mean, again, nobody knew what to do, how long it was going to last. You just heard on the news people were dying at record rates. There was no vaccines. You didn't know how you could catch it. Was it airborne? Was it in the water? Was it in the food? Everybody was panicking. The only advice I knew to give my patients is try and have the strongest immune system you can possibly have. The way to do that: vitamin C, vitamin D, probiotics for good gut health, because a lot of your immune system is based in your gut. So, that's what we told patients. Now, this COVID first started in China, and, they kind of came out of it somewhat before the vaccines. What they were actually using in the ICU, and this is from the NIH. NIH was studying this because it worked so well. So it's not some hearsay. It was on their website that in China, they were given 25 grams of vitamin C IV in the ICU every day for 5 days. And those patients were recovering from COVID and they were going home. They were not dying. The NIH was doing a study trying to, recreate that. And as far as I know, that study never got finished. I haven't seen the results of that, so I don't know if it got squashed or whatever when the vaccines came around. But that's what we were telling. That's what we were telling our patients. We weren't saying it cured COVID. We were just saying, hey, you need the strongest immune system you can find, and this is how you do it. I will tell you, I had that on my website, and after about 4, 5, 6 months, I got a letter in the mail from the Federal Trade Commission telling me to take that information down.
You're kidding me. I can't believe that.
Yeah, and other docs in other cities who I knew, and I knew they were on their, it had it on their website. They all received a letter from the Federal Trade Commission. So I mean, I don't have like some mega practice that's all over the country. I have a practice that's based in Atlanta. Why the FTC would care about what I have on my website and why they would be looking at my website, I have no idea. And I'm not going to start any conspiracy theories. I'm just telling you what happened. I can show you the letter. But that's what I was telling patients. And, I don't want to talk about vaccines, but I will. I will tell you one thing about medicine. I am weary of anything new that comes out from a drug company. So you have to understand, when drug companies do their testing on a new drug, they're doing it on 5,000 people, 10,000 people, whatever. But when you release that drug and now millions of people are taking it, you really have no idea what the side effects, what the long-term issues are going to be. You just don't know. I will tell you is that when the vaccines came out, I took the Johnson & Johnson vaccine. I took it because it was the old way of making vaccines. You take a little piece of the virus, you introduce it to the immune system. It's not enough to make you sick, but it's enough to make your immune system recognize it. The new messenger RNA vaccines are something new. We've never had a widespread vaccine program that used it. So I'm not saying it was good or bad. I tell you, I'm wary of it because it's new. When something's new, you just don't know what the long-term
Exactly.
So I like old drugs. Give me Benadryl, Bactrim, penicillin. I don't want anything that hasn't been around for 30 years. So we know exactly what the long-term benefits and the non-benefits are of a certain drug. So that's all I'm going to say about COVID, because the FTC might be looking at our show. All of a sudden we disappear, Steve. Nobody can find us.
I know about that. Let's move on. Because again, I trust you so much, and I told you that when I had COVID, they gave me what was called a cocktail, but a huge dosage of vitamin C. I think there was zinc in there, but I got to tell you, within 2 days, it knocked it right out, and I was really, really sick with it. And I know that IV absolutely helped me, maybe even saved my life.
Yeah. I mean, I tell you, here's what happens with studies that have been done with vitamin C. Is one, when they do a study, they usually will give it orally. Your gut only has a limited amount of vitamin C that it can absorb at one time. If you take 1,000 milligrams of vitamin C, you're only going to absorb about 30% of it. And 1,000 milligrams of vitamin C, and you're only getting 300 milligrams of it, it's not going to do a whole lot, but it's better than nothing. So a lot of times these studies will look at oral vitamin C, and I think they purposely underdose it because they want the study to say it doesn't work. When you give adequate amounts of IV vitamin C, it can do a lot of things. And there's over 1,600 studies talking about vitamin C and killing viruses, and vitamin C helping with cancer treatments, vitamin C doing all kinds of things. It's a great anti-inflammatory. It can help people with allergies. We give a lot of vitamin C IVs in our office. To tell you the truth, I had one yesterday because I hadn't had one in like a month. It's just something that I think, I won't say everybody, but most people need it. We are one of the few animals that cannot make their own vitamin C. Other animals can make vitamin C. And if you introduce an infection into an animal, their vitamin C levels will go up 10, 20 times. Okay, so that's why you don't see, especially wild animals, you don't see a lot of wild animals, looking sickly. The only thing they have to worry about is predators. But you don't have, veterinary hospitals full of wild animals who look sick or whatever. But it's only us and guinea pigs and one other type of monkey. That's why when you talk about you're being a guinea pigs are another animal that can't make vitamin C. So that's why a lot of experiments that they do before they do human experiments, they do it on guinea pigs because they're another animal that can't make vitamin C. That's how important vitamin C is. So I am a big advocate of vitamin C. And again, you're talking about why don't other doctors do this? Well, that's because the other doctors haven't looked at those 1,500 studies that advocate all of the things that vitamin C can do. And I always say, just because you haven't heard or read of a study doesn't mean that the study doesn't exist. It's there. You just haven't read it or know about it. And I always tell patients this too. I'm not a cardiac surgeon. So don't come to me and ask me, should you have a bypass surgery? Okay. I'm not a cardiac surgeon. So don't ask me about that. So also don't ask your cardiac surgeon, do I think vitamin C will help inflammation, and that inflammation is a precursor to cardiovascular disease? So we do two different things. Just like when I was OBGYN, you asked me about delivering babies, but don't ask me about brain surgery. So,
Right.
So don't ask a conventional doctor about functional medicine. But you can actually ask a functional medicine doc about conventional medicine because he's probably been trained in conventional medicine. And that's why you're asking me, what are the differences between the two? But, a lot of times my patients will go and ask their regular doctor about what I'm telling them. And, the doctor, a lot of times doctors, they're down on what they're not up on. So if they're not familiar with something, they think it's, irrelevant, but that's not necessarily true. That's what I thought when the patient came to me about bioidentical hormones. I thought it was irrelevant because I hadn't heard anything about it. But then when I went and researched it, I saw that, hey, this is what I should be doing with my life.
Well, we're sure glad you did. Speaking of bioidentical hormones, tell people what hormone replacement is.
Okay, hormone replacement is kind of what it says, replacing hormones that your body actually makes. So you say, well, why does my body stop making hormones? Well, let's talk about women. Okay. Women, they are born and they go through puberty. Why do they go through puberty? Is because they are entering the reproductive stages of their life. You don't want 3-year-olds having babies, so they have to mature to a point where they can be reproductive. So hormones have to change in order to support pregnancies. Then in menopause, you have to get out of your reproductive stage because you don't want 90-year-olds having babies either, unless you're Sarah in the Bible, they can do it. But you don't want 90-year-olds. So people they change out of their reproductive stage. So at those two times are the most likely times that your hormones are going to be out of balance, because anytime you have change, there's always disruption. So as the person is trying to get into their reproductive stage and out, there's a lot of what I call turbulence or disruption. So what you want to do is to replace that disruption and try and balance those hormones out. All life is about balance. We talk about work, home balance or whatever, but everything is about balance. So in women, is estrogen and progesterone, they need to be in balance. And those are the two critical times. But also what we're trying to do in hormone replacement is that there are external forces that can get our hormones out of balance. Stress is one of those. There are hormones in the food that we eat, in the water that we drink, and those can put our hormones out of balance. So how do you measure, how do you determine what's out of balance, you have to measure it, and you have to measure it appropriately. And the way you measure hormones, because they are fat soluble, they come from cholesterol, you have to monitor them, or you have to test them in the saliva. And that's the big revelation that I was exposed to after I got out of my obstetrics and gynecology residency. That was the light bulb above the head moment, is how you can actually measure hormones. Because when I was a resident, when I was practicing, I didn't measure hormones. If you were young, I don't care what you came in for, you got birth control pills. If you were older, more mature, let me say that, if you were a more mature woman and you were going through menopause, if you had a uterus, we gave you estrogen and Provera, or Premarin and Provera. If you didn't have a uterus, we just gave you estradiol. We didn't measure it. I told you the only way you stopped hormones is if the patient complained so much you had to stop them, or if you had signs that the patient was developing signs of breast cancer, you stopped it. But we never measured it. We never did anything, because the blood does not tell you anything about what the hormone level is in the tissue. It's only telling you what is in the blood, and what's in the blood is not really active. It has to go in the tissue. It has to go in the tissue, and that's where it activates its function. So that's what hormone replacement is. Proper measurement, and once you measure it, now you can balance it. It's impossible to balance something that you can't measure. You have to know something that you have to measure it correctly. So that's what hormone replacement is. Now, I will tell you, I like to call it hormone balancing and not hormone replacement, because here's what happens a lot of times. And I know we were thinking about getting into talking about testosterone and some other things.
Yes.
So here's what happens. When you if you say replacement, I'm not trying to necessarily replace what the body is making. I want to augment what the body is making. So let me testosterone is a great thing. So if I replace all of the testosterone that the body is making, the body will stop making its own testosterone, because your brain will say, wow, where's all this testosterone coming from? Or where is all this estrogen coming from? Let me stop my own production, because somehow I'm getting exposed to too much of this hormone. So that's why a lot of times, as you give more hormone, you get lesser response to it, because the body is shutting down its own production.
Wow.
Now, also with men, if you give too much testosterone, it will shut down its production, and men will complain that their testicles are getting smaller the longer they've been on this testosterone. And that's why men are having to take something called HCG, which stimulates something called LH, so that their testicles will keep producing testosterone, even though they're having all this testosterone replaced. And again, if you've got testosterone coming from the outside, and you've also got the testicles still making it, what happens is that the body becomes desensitized to it. And so you get less and less of a response the longer you're on the testosterone. Because so I have patients come in, I think my testosterone, I've been on this testosterone for 5 years. What's going on? I'll look at their testosterone, it's through the roof. The body has gotten desensitized to it. So what you really want to do is, so let's say that this is the right amount of testosterone, and now your body's making this much, or we can say this about progesterone or estrogen, anything. So this is the normal amount. This is how much your body is making now. So you feel the difference. We don't want this to stop. We just want to augment you. We want to give you enough that we fill in this gap, because we want this to keep working. We want your testicles to keep making it. We want, and women who are premenopausal, we want their ovaries to still make it. We just want to augment it. So instead of replacement, I always like to say balancing or augmenting, because
balance makes more sense.
Yeah. So we don't want to necessarily replace what the body's doing, because the body is a lot smarter than we are. I'm just telling you, that's what I'm saying. When it sees all of this, it'll desensitize itself, It'll stop production because it wants to be in balance. It wants to stay in balance, and it'll do what it needs to do that. And if you don't understand that, we'll get frustrated. We'll say, oh, the patient's not absorbing it. Oh, the patient's doing something. No, the body is just trying to protect itself. I tell patients, I said, look, your body wants to live even though you keep trying to kill it. We try to kill it with stress. We try to kill it with over medicating ourselves. We try to kill it with not sleeping enough. We do all these things to try and kill the body, and the body keeps trying to live. And so we need to understand that. We need to be mindful that, hey, if the body's not responding, maybe I'm doing something wrong. Maybe the body is trying to tell me something. So that's something I always kind of, keep in the back of my mind. Am I trying to kill my body even though it's trying to live?
So is it dangerous? Because you hear these bodybuilders always saying how they're trying to put more testosterone into their body.
Yeah.
But what you're saying is that the body is going to shut down if it's getting too much.
Exactly. It's going to shut down and it's getting too much. And then here's the other thing. You get if testosterone is too high, one of the things it'll do, I don't know if it's the first thing, it will start converting some of that testosterone into estradiol. Fat tissue it has something called aromatase that can convert testosterone into estradiol. So like I said, the body's trying to create balance in whatever way it can. Now, these bodybuilders don't have any fat tissue. Okay. So what has to happen is that they have to keep using more testosterone, or they have to start using more stronger drug-like testosterones that are stronger, that can override it. And so that's what happens to these guys. They keep having to get more and more to get the same result. And it always ends up badly with these guys. I mean, you don't see a lot of 90-year-old bodybuilders. I mean,
Yes.
Those steroids, I mean, they wreak havoc on the brain. They overwork the cardiovascular system trying to get enough blood to all of those muscles and all this stuff. It is, it's a shame, but they get addicted to it. It's kind of like chasing a high where you keep having to get more and more trying to get that same result, and it ends up eventually being detrimental.
It must bother you a lot when you see all these commercials on TV, talking about giving your body more testosterone when it hasn't even been tested. You don't even know what your levels are.
Yeah, correct. Any middle-aged man who comes in, it's kind of like I told you, if a woman comes in with any problem, you gave them birth control pills. If any middle-aged man comes into an office and complains of fatigue or, not feeling quite right, they're going to get testosterone. Okay. And even if they do a blood test and the testosterone level is normal, a lot of docs will still put these men on testosterone because, if all you have is a hammer, everything looks like a nail. But most of the time, the guys that I see, a lot of times it's not a testosterone issue. Sometimes it is. More times than not, it's a cortisol issue. It's a stress issue. And where the stress has suppressed their testosterone production. So the original problem was the stress, and then the secondary problem was the testosterone. So if you correct the abnormal cortisol levels, their testosterone comes back to normal. So because a lot of times if you just give them testosterone, they'll get some relief, but it's not really all the relief that they're looking for. So you need to know what's going on before you do a therapy, because like I said, so what happens is they buy this testosterone, they take it for 6 months, and they don't feel any better. So they've just wasted 6 months of their lives, wasted a few, I mean, it's usually not that expensive, wasted some money, but now whatever the original problem was has probably gotten worse, and now they go out and have to seek some other type of treatment.
I got to tell you, Dr. Taylor, because I've been hosting these shows for a long time, and I've actually had companies come to me going, we'll give you the product and then all you got to do is take it and then tell people what it's doing for you.
Right.
And not one of them ever said to me, let's test your testosterone, your hormones, to see where you're lacking at. They just wanted me to start on the giving myself shots every day. And it just, it was really putting the cart before the horse.
Well, this is what I will tell you. If I give you testosterone, even if you don't need it, you'll initially get a boost. Okay. It's called a little steroid high. You'll get a boost. Okay. So you'll say, oh man, this stuff is great. But if that's not necessarily what the problem is, it's going to fade away. It's going to, after 2 or 3 months, after your body readjusts to this, it's going to fade away. Because again, well, like I told you, if you'll get that initial boost, your body will say, hey, where does this testosterone come from? Hey, let me shut down my production a little bit. And so you end up right back where you were. So that's why they say, a lot of these companies will say, hey, let's try it, and you can get an initial boost from any type of steroid. You can give women estrogen; they'll feel good for a while, and then they'll start gaining weight or whatever. So if you don't test and you just go straight by feelings, sometimes you can cause somebody to feel better, but it's not necessarily what they need. I tell people, hey, look, I can give you a drug, I can give you cocaine, and you'll feel better, but it's going to fade away, and eventually you're not going to be able to get that same high. And that's kind of what can happen with hormones also.
We just got 3 questions in a row from listeners wanting to know if the saliva testing is new.
No, saliva testing has been around since 1960. And a lot of the articles were written in the 1990s. So it's nothing new. Saliva testing companies have been around for a while, and it's not expensive. So I know we're worried about what insurance companies will pay for or whatever, but this is what I tell patients: hey, you make a little investment to actually know what's wrong with you, and we actually correct it, instead of you doctor hop for another 2 or 3 years, and not finding out what's wrong. So with the testing that we do, we can look at estrogen, progesterone, and testosterone, and we charge $135 for that. If you do those 3 hormones plus doing a 4-point cortisol, it's $275. If you just do the cortisol, it's $160. So it's not that much of an investment. Now, some insurance companies might pay for it. We will actually bill the insurance companies for you to see if they will pay. This is close to the beginning of the year. It's March. A lot of people haven't met their deductible, so insurance companies aren't going to pay. So if you're going to spend $200-300 on something, out of the $1,000 deductible that you have, you might as well spend it on something that might benefit you. Because most of the time, patients have had the same routine blood test done over and over and over and over and over again, and every doctor says your blood work looks fine. So if I do those same tests, it's going to come back the same way because it's the same body, it's the same blood. So I tell people, let's look somewhere else. Let's look at another, in another closet. Let's not keep looking in the same closet for your shoes. They're not there. Maybe you put them in the downstairs closet. So we're going to look in the saliva closet and see what's in there. So we're going to look somewhere else. If we can't find the problem, what the problem is here, let's look somewhere else. So that's kind of how I explain it, is that, if I look at your same blood, the same results are going to come back. So, saliva testing, less than a $300 investment. Insurance company might pay for it. We can see, if nothing else, it'll count.
Look at the benefits, though.
Yeah, and it'll count against your deductible. At least you'll have $300-400 less of your deductible that you have to try and match. And like I say, if what is getting rid of hot flashes and a good night's sleep, and knowing that you can take these hormones safely. That usually what I will do is, after that first test, if you're on estrogen, we test you every 6 months. If you're just on progesterone, because progesterone is not going to increase your risk of cancer, we test you once a year. So we're going to monitor you properly. We're not going to wait till you have a positive mammogram to do something. We're going to make sure that we keep your hormones balanced over the long term. And hopefully you're able to function well, throughout your lifetime.
Well, like I told you at the beginning of the show, this is an incredible show. Dr. Taylor's with us every month. We're going to be getting into some female topics, health topics, as to hormones in the coming weeks. If you are watching us on TV right now, you can see we're scrolling throughout the show, the website. Best way to get a hold of Dr. Taylor and make an appointment. If you're on radio, Dr. Taylor, give me your website and phone number.
Okay, my phone number is 678-443-4000, 678-443-4000. And my website is taylormedicalgroup.net, taylormedicalgroup.net, not .com. I think if you do .com, it's a law office. So they're not going to be able to help you.
We got several phone calls for you. Well, listen, thanks, Dr. Taylor. And hey, we'll see you this afternoon in Dallas.
Right. Okay. I guess I'll have to take a quick flight out there.
Yeah. We'll see you then. Thanks, Dr. Taylor.
All right. See you. All right.
That's
bye-bye.
Dr. Eldred Taylor. He's the Taylor Medical Group. And we are going to be back with you again next Wednesday at 10 o'clock. That is Eastern Standard Time. If you have a business, whether it's a health-related business, a legal business, financial business, and you would like to come on our show, you can reach us at 954-336-3767. That's 954-336-3767, and we can talk about getting you on our show. I want to thank everybody for tuning in today. Thank you, Juan, so much. And everybody have a safe and healthy week. Take care.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.